A common question we have is, what is a breast lift? People come in, whether they're interested in implants in a lift or a lift alone, they're interested in what is a breast lift. The other question as part of that they will ask is, what is reduction compared to a lift? So a breast lift, really what the focus is tailoring loose skin. So somebody might come in their 50s or 60s, and sometimes earlier if they've had multiple children and breastfed, where the nipples have dropped and maybe they're pointing towards the ground instead of pointing straight out where they were when they were maybe 18 or 20. So a breast lift is really designed to get an ideal nipple position and to remove excess skin. So the way I kind of think of a breast lift is, if you're somebody who wears a size 6 dress and you lose 10 pounds, you can't keep wearing a size 6 dress. You either buy the next size down, or you go to your seamstress or tailor and have them take out the extra material so that it fits you better. With a breast lift, we're really just taking out skin to sort of reshape the breast so that it fits better and making sure the nipples get better centered. A breast reduction is very much the same surgery in terms of taking out skin, except that we also take out breast tissue. So it's somebody who says, I don't like the weight of my breast. I'm getting back pain, neck pain. They're actually having symptoms. So the breast lift patient usually likes the way their breasts look in a bra. They just don't like how their breasts look when you take the bra off. They fall. A misconception that a lot of people have, so the patients will come in the office and they say, I've been thinking about this for a long time, I want a breast lift. And they stand in the mirror and they take their breast and they do this, and they hold them up by their neck. That is not a breast lift, that's more of a forklift, and nothing I do will replicate that look. So when we have a breast lift consults, one of the most important things that we do is establish realistic expectations, right? There's nothing in the world I can do that can actually take the entire base of your breast and lift them up that high. It's really reshaping them in the position they are now. They will look less long, they will absolutely look perkier, but it doesn't completely reposition the breast on the chest wall. It's really more tailoring. It's very easy to demonstrate for a patient in front of a mirror what that breast lift will do. What a breast lift also won't do is, when people come in, they often say, well, I feel really hollow up here, and so I want to lift, and so they shove their breast tissue up, and it suddenly looks fuller. Well, yes, of course it does if you're shoving your breast tissue up. But the lift won't do that. Again, it'll reshape, it'll reposition the nipple, but it won't. If your main concern is that hollow upper pole, that's really solved with an implant. So some people come in wanting a lift, and they end up booking for implants and a lift because the implant portion solves the hollow upper pole. The lift handles the nipple position. So it very much depends on what the person presents looking like.